Do you have a 14-day kit ready for you and your ohana? Not just for a natural disaster, but for the coronavirus outbreak. Joining us now with a look at what we all need and why is Jonathan Hiltz, public health educator with the State Department of Health. Good morning, Jonathan. Thanks for stopping by.
Morning.
First of all, talk about the importance of having this kit ready and why we all need to take it so seriously.
Well, of course, yeah, people have heard lots from us that this is something you should always be doing. Every hurricane season, which runs from about June till November, we're constantly pushing people to have a family emergency kit that lasts at least 14 days. And of course, there is no earthquake season or tsunami season. That can happen anytime.
Right.
So we want people to be prepared. And this is the same type of thing. Now, with a hurricane or a tsunami, a natural disaster, we might be worried about the water turning off or the electricity going out. That's not really a concern here, but we still want people to have an emergency kit that will last at least 14 days because they might have to be at home for 14 days. If they're exposed to somebody, if they're caring for a loved one who might be sick, they might not be able to go out to the store, they might not be able to go get groceries and whatnot, and so they need to think about what they need to have at home if they are stuck there for 14 days.
So again, the reasoning is slightly different, and it's not because we're going to run out of water or toilet paper. It's because if you're sick and you cannot leave your house and no one else can deliver anything for you or to you, so remind us again, what do we need in that kit?
Well, generally the things that we want to push with people is a 14-day supply of food, water, and medicines that they might need. Now, the food is very important, of course, because you have to eat. The water is not so important for this type of emergency because people should already have that, and also they can still run the tap. Coronavirus is not going to take out the tap water, you know, so if you have a filter or something. But we want to make sure people have medicines that will whatever medicines they normally need, they should start thinking about that right now, being able to go to their doctor or their healthcare provider and seeing if they can get that ahead of time or arranging to have it mailed to them so that they have it because they might not be able to easily go to the pharmacy or whatnot.
What about cash, money, or any important documents? Because usually we're being told you should save all your important documents on a flash drive so you can just grab it and go if needed in a natural disaster type of emergency.
Right. Well, especially in a natural disaster, people should have cash because you might have a situation where their credit card won't work, they might not be able to go to the ATM. It's not as important in something like this, but they should still have cash on hand so that they can go and pay for things, you know, quickly with somebody. But having your insurance documents and other things, it's good to have that in order in general. And this is our perennial message. We want people to be prepared all the time, not just when there's a COVID-19 threat. You know, right now we don't have community spread, but this could happen. And we want people to think about what that will look like if they're stuck at home and they can't leave, and or if they have to care for somebody like their auntie or somebody like that.
Final message in talking about preparations. Let's talk about outside this supply kit. What's your final message when it comes to residents and how prepared they need to be?
Well, we really want people to think about how they can protect themselves from sick people and also protect other people. Social distancing at a time of a pandemic is really important. If you don't need to go outside, you know, maybe consider not going outside, especially for elderly people or people who might have health conditions that make them a little bit weak. If you're home, if you're sick, don't go to work. Don't be a hero. You know, just stay home.
Right.
Talk to your employer about how you might be able to work from home, telecommute.
All right. Thank you so much, Jonathan Hiltz with the Department of Health, for stopping by those important tips and messages.